Welcome to Threads of Enlightenment, a podcast devoted to helping you overcome challenges in your life that prevent you from becoming the best version of yourself. Each episode features interviews with people from all walks of life about their journey of self-development and the principles they utilize to overcome their fears to achieve their desired outcome. Ready to be enlightened? Here's your host, Ken Primus.
Welcome to Threads of Enlightenment. As my custom here at Threads is to welcome our guests, because I know they're coming with a couple of things very expensive, their time. Every one of us have been given 24 hours. How we respect and honor time will tell a lot about you. The other is the journey. The journey is a creative force that created the individual before us. And I am so honored to have Doc here in our studio to have this conversation about who he is and what he does. And so we want to welcome him and thank him for coming by and sharing both of these precious commodity here with us at Threads of Enlightenment. Doc, thank you so much.
Hey, Ken, great to be here. It's an honor to be here with you and your listeners. Yeah.
Thank you. As I said on the onset, one of the questions I ask people is, how do you serve mankind? Because I want to let them know that this is not all about just them. It's also about reaching and talking about the connectiveness of mankind, all colors, all creeds. And so how do you serve mankind?
Thank you so much. That's a great question. I, in my new book, Revolutionary Optimism, I explain how I do it. And I actually believe that there's 4 circles of service, and I look at it that way, and I think about it and live into it that way. So the first is, how do I serve self-care and self-love, like myself? I'm a human, and I have control over this human, sort of, at least more control than other humans. And I feel like it's a top priority for me that I've learned, which is to focus on asking the question, how can I serve me today? Do I need a break? Do I need to go to a doctor? Do I need to, whatever I need, to take care of myself? That is priority number 1. Second circle of service is family, loved ones. How can I serve them? I have to serve my dog. I have to support my wife, my children, my grandchildren. That is like the next circle. Then I go into my community. How can I serve my community? And then thirdly, I ask the question of how can I serve our world? So it's a practice. I'm not saying I do that every day so perfectly, but I like to have that as a tool to make sure I don't forget myself, because I think that's a common thing. People forget that they're included in the service, a quotient here. And then, think about it at all those levels, because they are all interrelated, as I think you said.
Yeah, I think you're absolutely correct in that progression. One of the phenomena that we have on this planet is called burnout. And that's because the person hasn't dealt with the first aspect of servanthood, which is dealing with the self. And so when someone comes to me and say that they're burning out, I know exactly what's going on. So one of the things that we deal with, one of the customs here, Doc, is to go back into that time machine that is called the memory and revisit some of those spaces that we reside for a short period of time. The first is usually the family. We go there and we reside several years before we embark on our individual quote unquote journey and so forth. So we want you to invite us into your family unit. What was it like as a young man?
Well, I published a memoir called Waging Justice, which I share in great details about my early life and my evolution through my journey. I grew up in a small, parents, neither of them went to college. They owned a hoagie shop in Philadelphia. I worked at the hoagie shop. We were raised in a Jewish conservative family. My father was a rabid Zionist, and I always thought we were normal. And at the same time, I had that story that we were normal going in my head. I also hated my father and didn't know why. I voraciously, had an aversion to him, and I didn't want to be around him. I didn't trust him and all that, even as a young boy. And it took me till my late 40s, 40 years later, I realized that I had an amnesic barrier and that I was a survivor of childhood sexual violence at the hands of my father.
Oh, wow.
I didn't remember it through all those decades. I knew there was something, I knew that I had this inner anger, and I knew that I was plagued by an inner dragon that was very tough on me. That struggle that I had about inside of me because of that trauma and not knowing about it actually, put me
Yeah.
on a healing path. So I began an inquiry into like, how can I be happy? How can I serve?
Yeah.
How can I work on myself? So I
Yeah.
started really doing that kind of work in my teens and deepened it in my 20s, 30s, and throughout my life. And yeah, so I still do that to this day. Have spiritual practices and practices that help me generate myself to be my highest
Yeah.
self. So the early childhood trauma put me on that healing journey for myself. And I've done every modality I think out there. I've done a lot to
Yeah.
get to where I am now.
Yeah. I tell people, I try to encourage them that pain, that trauma, when you're young, it is a traumatizing situation. Then as you get older and you're coming face to face with it, it becomes one of your superpowers that you're able to reach back. It guides you into your process of finding who you are and healing and all of that stuff. And then you're able to reach back and comfort someone that has been afflicted by that same trauma. And so it will be used, I tell people all the time, it will be used again and again and again to assist others to come through their trauma. So realize at some point that if you allow the fullness of your exploration and your journey to come to pass, trauma will be utilized for a good in this planet. So just keep moving.
Yeah, that's a really great point. Thank you for saying that. If I could just share quickly,
Yeah.
what happened for me was that when I found this all out, and as I was in my healing journey at that moment, I made a commitment to do whatever I could to prevent other children from going through what I went through. And I
Yeah.
do advocacy campaigning and movement building. That's my gift in the world. And so the thing about it was I made a commitment that I was going to do that. And then now
Yeah.
I'm still living into that commitment. So I've been involved in setting up Keep Kids Safe, which is a U.S. movement to end childhood sexual violence. The Brave
Yeah.
movement, I was a founder of that. I just say this not that so that people understand that advocacy and campaigning and movement building is a healing modality. By taking
Yes.
a stand based on your lived experience, it actually is empowering and it pulls you out of, it can pull you out of despair because you're actually
Yes.
serving, to your earlier point. So it's a form of service. I just want to make that clear.
Yeah, it changes and brings you into a different state when you become a servant. It
Yeah,
helps you to navigate from whatever depression or whatever mind state that you're in.
exactly.
So here you are, Doc, this teenager, kind of aware of some trauma, and you're heading towards, and you made some internal commitment that you will assist those that are going through. As you have that internal compass in you and you're heading towards college, which college did you pick and which field did you pick it? Yeah, did you pick to get to begin that journey?
Yeah, I went to Muhlenberg College in Allentown, Pennsylvania, and I went there because it was a very strong pre-med program. I was a biology major, and I really focused, by my third year, I was hyper-focused on biochemistry, which is the interaction between the chemicals in our body and our
Yeah,
physical structure. And through that, I then, was accepted to go to medical school. And during medical school, I realized that I really didn't want to be a clinical doctor. It's like I
mm,
went through a bit of a crisis. I thought differently about problems, and I had suppressed my squeamishness with
yeah,
blood and body fluids and bad odors and stuff. And I realized I really didn't want to do that because I am squeamish and I'm colorblind and red-green
yeah,
colorblind. And so I can't see rashes on dark-skinned people. And when you're in surgery, I couldn't differentiate different body parts, because they all looked gray and like a
yeah,
big mush. The colors were all, blurred to me. Anyway, so then I found public health and preventive medicine, which was a way of looking at the health of the population and
yeah,
looking at how do you understand the risk factors for disease and how do you prevent disease. And so that's the path that I pursued. I went to Johns Hopkins University and I did a preventive medicine residency. I got a master's in public health. And from that, I really focused on child health and child survival. My first job was really focusing on global polio eradication.
yeah,
We had been trained at Hopkins from the folks that eradicated smallpox. So they were like, we have a technology. How do we get it to global scale? And so
yeah,
then, I went right, I go, oh, wow, that's me. That's the kind of challenge that I want to take on. And so my first gig after that was like the disease at that time that we were trying to eradicate was polio. So I
Yeah.
spent time in Latin America doing that. And then I got called to Africa as a young professional, and I really was keen to, you know, I don't know why I was drawn to go to Africa. It was where at that time the suffering was the greatest, the child health statistics were the worst. So I ended up focusing and traveling all around and working in many African countries. And then I lived in Zambia in southern Africa for 4 years
Yeah.
in the late 90s.
Wow. So here's this young man that is basically thrust into a life of a servant as he's moving through school and life. Basically graduated, and he's just moving through life, and he's in that realm of servant, going to people that are not capable of giving back, if you will. How was that affecting you?
Yeah, I mean, I think I identified myself as a healer as I went through medical school. I loved being in that role as a healing servant, helping people navigate the healthcare system and making sure they got the best care. I just got frustrated because I thought that the system was not always looking out for the best interests of the patients. I felt like the incentives were for the physicians and the insurance companies for you to get more procedures done. I called it scoping for dollars, get more scopes done, more procedures done. And that's how the system made money. And I saw that very quickly in my medical training. And I was just like, that didn't feel right to me. And I also felt like the whole system was oriented towards end stage care and managing chronic diseases. And I kept asking the question, like, why don't we do more to focus on well-being and prevention? Why am I here treating a lung cancer patient who smoked 3 packs a day for 30 years? Why don't we get them to stop smoking, and, things like that. So I was a little bit lost because I was alone. No one else in my whole environment thought that way. And so I was so grateful that I got involved with student politics and student organizations and had a lot of joy doing that. And then I got to travel and go to conferences all over the country, medical student conferences. And I was able to break out of like the standard pathway. I found out about public health and preventive medicine, which is a very uncommon pathway for physicians to pursue that at that time. Now it's become much more common and vogue. But yeah, so it was me going from serving the individual. The leap that I had to do, like kind of in my heart, was that, okay, there's different ways of serving. I can serve one-on-one. I could see you as my patient or anyone. And I did enjoy that. And I do like connecting with people at that level. Or I have to give that up and I'm going to serve at the population level. And that's what I ended up doing. And I wanted to have a family, and I felt like I couldn't do everything. So I gave up clinical medicine and went into public policy and advocacy. And I don't regret that for a minute, although it was a difficult thing to do at that time. So,
I tell people one of the enemies of healthcare is the business of healthcare.
Many doctors would.
Yeah, I've seen, because I came from healthcare as well. And the business of healthcare can be something else. It erodes it can, and it does, erodes one's soul, I guess. That's what it did to me, Doc. And the bureaucracy was so big, and you're trying to figure out how to interject some common sense, I guess, if you will. But no one is interested in common sense and stuff, like you said, an alternative way to approach that healthcare system. And like you said, you had to step out and where you're able. But I walked away from it because of that, because I just couldn't take it anymore because of what they wanted me to do and what was the cost. And I told them the cost was too expensive. And so I took off and walked out from it. So here you are now.
Can I just quickly say something about that? One
please,
of the concepts in my book that I talk about is that as we're on our journey, we have to discern what our calling is, what our life's purpose is.
Yeah.
And as part of that, we have to embrace what I call shape-shifting. We have to experiment with, I'm going to experiment with serving in this way. And then we get to a point where our internal compass says, no, we're misaligned with how we're serving, like the example you just gave. And then we have to find alternative pathways to serve. And we shape shift. We have to maybe change things. And I know I struggled with that and I didn't get support for that. And I want to just offer you and your listeners that that is good news, that it's a healthy thing to shapeshift. It's a
Yes.
part of our journey. And it's like our culture and our family culture. And like we need to embrace that ability to shapeshift, to continue to try to find that place of inner alignment with our outer service. That's what
Yeah.
I have learned in on my journey.
I 100% agree with you because eventually that's what happened to me. I had to, I came back in, I walked away from the healthcare field for a couple of years. When I came back into the system, I was a little more mature. I was a little more aware that I can do the shape shifting aspect within the healthcare system. And I found myself working passionately in healthcare later on. When I went back in from a different point of view from where I was writing policies and procedures and the money and all this stuff. And I began to work with in a skilled nursing facility, which being in that atmosphere made me such a better man and helped me to grow at a deeper level that I would have ever been able to do had I not been there. So I absolutely 100% believe what you said about the ability to do that, to shape shift, and so that you can find other ways. I was still serving within a field that I absolutely love, so find your way, guys, find your way. There's so many different aspects and you have to get inside of yourself to allow, because what I did when I left, I had to grow because I was this not rebellious, I was this outspoken young person and a radical in a little way and that kind of thing. And the system was standing there looking at me and I just needed to vacate for a while and then I came back in. But yeah, that's part of living and part of growing. So here, Doc, you're doing this, and I know you were there at the front line of many of those disease processes that began to hit the planet, the surface. We know, reading all your stuff about AIDS, you were there and all of those different things. Being in that mix, how were you doing? I know the servant, because you've been the servant for so long and you made the switch, you change. How are you doing in the midst of all of that? How was Doc doing in the internal man? Because remember, you still had to be dealing with this issue that was residing with you as a young man that propelled you. And I'm sure those type feelings, those type memories and things and underlying stuff will start manifesting. How were you doing, Doc, amongst all of this
Yeah, I mean,
busyness?
in retrospect, I was passionately driven to protect children and to
Yeah.
ensure that they were healthy and that they had education and that they had services. So, for example, when I was living in Zambia, we realized that economically productive adults, 15 to 44, were dropping dead from HIV, and there was a secondary orphans crisis. There were millions, literally millions of orphan and vulnerable children being left behind, and no one was doing anything about it, yet alone even knowing how vast the crisis was. And so I got involved very intensively in the late 90s in advocating for and then implementing large scale orphan, orphan and vulnerable children care and support programs and trying to keep the kids in their extended families whenever possible, avoiding institutional care, making sure that they got the full range of services. So, and I had some big fights with people. People like didn't want to. I tell the story in the book in Revolutionary Optimism about how the head of the office that I was working in refused to take money that Washington was making available to us for our orphans crisis because it was such a new thing. It was like
Yeah.
a new pot of money that they had, and he was like, "No, you can't. We're not taking it." And I mounted a campaign and like got experts to come in and put pressure on him. Kind of went over his head a little bit, and he
Yeah.
didn't like it. But anyway, we won. We got the money, and we got the first programs. And then when I came back to Washington, and I became an advocate, and I was with George Bush made a commitment after years of advocacy he launched what's called the President's Emergency Plan for AIDS Relief. And so when the legislation was being written on Capitol Hill, I don't know what happened. It was kind of divine magic, I think. I happened to be in the room where the committee was marking up the bill, and we said, can you do an amendment for orphan and vulnerable children? And so they were like, sure. So they earmarked 10% of this multi-billion-dollar fund to go towards orphan and vulnerable children. And that led to large-scale programs to address orphan and vulnerable children, across Africa for 20 years now. And I'm just so proud that, it was because of I didn't know this then, but it was my passion for protecting the rights of children. The injustice that I experienced led me to be voraciously committed to protecting other children. And, I did it in a small way in Zambia. It was significant, but yet relatively small. And then the moment the confluence of circumstances appeared, and I was just like, boom, 10% for the next 21 years now. This is a $6 billion a year annual program. So 10% of that is a lot of money. 600 million times 20 years is billions of dollars. That really has changed the trajectory for millions of children. And I'm just like, I'm not directly, I don't take credit for all that happened, but like I was there in that moment and did what I could. And so proud of that work as an example. And during that time when I was working on global AIDS, we knew that violence against women and children was a big generator of the pandemic, forced sexual activity by adults forcing women and also children under 18. And so I got very deeply involved in the issue at that time and very passionate about all children, boys and girls, need to be protected. I was like, honestly, I had no idea why I cared so much about all that. In retrospect, it was like really helpful to have my memories come back in my late 40s. And because then I look back and go, oh, now I understand why you were so, I was like really like worked up about it. And it's just funny. Anyway, so I think I answered that.
That's a powerful testament to, as what I stated earlier, Doc, that one's trauma becomes that guiding force within their life. And a lot of people don't know it until they will later on, like you did in your 40s, when you have that revelation of the core reason, the genesis as to why that was there. And I think the designers, when they put this together, this thing called life, knew that we are a little off in our ways, but yet they are able to, that they would take our trauma that we would receive and use it to become servants and beautify that pain in a way that started the journey, if you will. And so I think it's a testament to how you have beautified the trauma that you suffered as a young boy by being such a passionate advocate for children worldwide. And that's one of the messages I always want to get across to people, that don't, because I've had some of my friends committed suicide, and I tell them there's no need to allow the trauma to cause you to make that decision. Seek help and learn to make it your weapon and beautify it and rescue others that were in that situation. So thank you for sharing that, because I want people to really get the power within that story that you talked about. And so it guided you most of your life. So here you are, Doc, when you'd mentioned to me that you are right behind the closed door as age with me. In the 40s, when that revelation came to you, what did it do to you as you are now exposed to the memory of that when it hit you? What did you do and how did you handle it?
Yeah, so I had come back from Zambia, and for like over a decade, I ran an advocacy organization to put pressure on the governments to commit to the multi-billion-dollar investments and make sure the money was being used in the best possible way to have the greatest impact, to save lives and care for children that were left behind. During that time, I was an effective advocate as part of a broad ecosystem of actors and players. And over the years, I was a really angry advocate. And I got to a place where the anger was kind of eating me up inside. And then I I kind of convinced my board, I need a break. I need to go on a sabbatical. And I took a sabbatical and I took a break. And I think I had reached a point in my life of, I had succeeded in some ways, and I had a family, and externally everything looked great. I was having a public policy impact, but inside I was miserable and angry, and I realized that dissonance was not sustainable. So I went and took a sabbatical, went into a deep dive review. These memories came back. It was shattering. I was completely shattered. I was like, all the stories that I had about my life were completely destroyed. And then I confronted my father, actually. He was living at the time, and he, of course, denied it and thought I was crazy and all that. And his reaction just affirmed my memories. And I talked to lots of different people, and, I had a lot of doubt and confusion. Like, is it real? Is it not real? And I went through that for a long time. And then I just I did my own epidemiological investigation, and it just made everything make sense. And it just clarified everything. And as I said, I got a lot of support, and I made a commitment that I would do whatever I can to protect other children at that time. So I have been living into that at work. I work actively on that issue now, and I'm, been involved as a survivor. I think male survivors stepping up and speaking out is important. It's probably 25% of the population. 1 out of 3 girls, 1 out of 5, or maybe even more boys. It's so clouded in secrecy. And I'm not saying everyone has to speak out like I do. I mean, that's just, I do. But I just do want to invite people that might have memories or might have had some experience, even if you don't remember all the details, or even if you don't want to go there. It's also like an opportunity to take a stand for your children, your grandchildren, and children around you, so that they don't have to go through that. That's what I found for myself, and there's evidence from experts that advocacy is a healing modality. And then I also really had to follow my heart, which was that I had been doing HIV/AIDS and advocacy for 15 years, and I was really I had learned a lot about how to be an advocate. So I wanted to work on other issue areas. So I started working on the climate emergency. I've worked on racial equity in the United States, and I've worked on authentic democracy and sustainable development goals like social, economic, and environmental justice. So a broader range of topics. So I think for the past 10 years, at least 10 or 15 years, I've been, still working on global health to a lesser extent, and taking on these other issue areas as a greater extent.
Yeah, that is powerful information that you talked about as far as how you came about and what you did, because there are lots of men out there, Doc, that are in similar situation, and anger is one of the things that they deal with. Shame is another. Great shame as a man, and how society relates to that. And I want those men that are listening that have experienced some of these things. We have someone that I'm going to provide Doc's information so you have access to him, the books and everything, so that you can reach out and begin to get some type of healing within the self, because it's important. As you heal you'll be able to heal much of your relationships outside, meaning your family, as Doc had stated. It's first you, then your family, then your community, and then the world. And that's also based on your healing. As he begins to tell us his story, that's the progression that he handled in his life and how he changed and so forth. So Doc, you've gotten this, and I want you to go in, because I know you have another timeline, and to talk a little about your book. And then what I want you to do is the 7 steps of living a love-centered activist life. Talk a little about that. But I want you to, some of the movements that you have coming up. And I see in the back of you, your clemency, emergency, human rights, no, not hate. And there's a date that I can read, April 25th. I think it's did it pass last year? So talk to them about stuff like that you have coming, because I want to point them to it and make them aware, the audience aware of some of the other things that you're doing on the outside in the field that they can have access to and even be a part of.
Yeah. So as you said in the beginning, I am a human, and there are times where I get hopeless and despairing. And the state of the climate emergency, for example, the collapsing of our pseudo-democracy, the rise of fascism in the United States and around the world, the lack of, the betrayal of our government basically to fulfill on its intent of, ensuring our well-being. And I knew that 2024 was going to be a wild ride. I anticipated that. So back in 2022, I started working on revolutionary optimism, and I created it, it with 7 steps as a journey and with practices, and I call them RXs or prescriptions. I use my doctor role, and I offer stories of people and my own stories and share wisdom and best practices from the literature. Most importantly, I have practices. It's the book is like a compilation of the best practices on living as a love-centered activist, and 23 practices in total. And I felt like this is a love offering for me to whoever reads it, because it's the kind of book I wish I had when I was 15 or 20 or 30 or 40, 50. Even at 60, I would have ran for a book like this, because it helps me maintain my revolutionary optimism in the face of circumstances. And it's working. It works on me. I am doing these practices. I went to Israel, Palestine last week on a pilgrimage to look for peaceful solutions. And boy, it was a real stress test on myself and on revolutionary optimism. And I came out of it and I found there is a way, there are people, there is movements afoot to really bring forward a peaceful resolution, peaceful coexistence. But I had to use all the practices in my book. And while I was there, it was when the massive explosion of campus encampments that are supporting the Palestinian liberation movement is emerging, and climate activism is emerging. So I believe that we're going through a passage as humanity, and it's going to be a rough ride. And we're at a crossroads. We have to decide whether we want to continue down the path that we're on now, which is extractive capitalism and oppression of one group of another based on race and other things like that. And that's leading us to great suffering, and ultimately it will lead to destruction, possibly including our self-destruction as a species. Or, this is where I'm aiming, is that we can heal and repair and transform ourselves as humanity, so that we can have a path of justice and repair and peace. And we have to do it now, actually. We don't have more time to wait. So revolutionary optimism, the 7 steps, the real underlying part of it is really like the first 3 steps are about self-liberation. The stuff that you were talking about, finding your purpose, trusting your intuition, connecting with the great mystery to inspire you and to help see the interconnectedness of everything and everyone. And then step 4 is the heart of the book. It's the bridge in the book. It's called peace crafting. And it's about like, how do we relate to other people? And it's like the space between you and me right now, and me and your listeners. I'm using peace crafting as I'm doing that. And it's about, and I can go into the details of that. Then steps 5, 6, and 7 are really about our collective liberation. It's interrelated to our self-liberation, that journey that we're on. And the more that we make progress on that with ourselves and with others, then this collective liberation becomes more possible. And it talks about imagineering, having a vision, radical imagination, unlocking our visions, and then manifesting them through movements. And then step 6 is sparking peaceful revolutions. I definitely believe we're in a phase of violent revolution. If you look at the news or what's happening on our streets or the wars going around the world and the threats that we're facing, that's already happening. And there is a peaceful revolution already happening, but a lot of us that are in that are in our little silos, and we're not connected. We think we're alone. We're not using our full, we're feeling hopeless and despairing. So I'm really going for all of us that are already there to recognize that we're doing great things. Every love-centered action counts. People are frequently hypercritical of themselves, like they're guilty, they're not doing enough, or they don't think what they're doing is having an impact. I hear this all the time. It's like, wow, what you're doing is super amazing. you're serving in the way that you choose, and that is it. You're it. That's part of what we're advocating for. And then the last step is on unifying within, like unifying that inner soul's purpose with how you create your life. And that's an onward journey. That's a constant thing that evolves. And also unifying collectively. How do we see each other interspiritually? How do we see each other interracially, interpartisanly? Let's break down the walls, these silos that aren't real. We're all really aiming for the same thing. We all are yearning for love, peace, and freedom. And we're not experiencing that. And we can recreate everything so that our world is operating with love at the center of our social, economic, and political systems. That's my ultimate goal.
I suggest that all of you guys are listening. A beautiful gift to buy for teenagers, college students, and all you rebels out there. We look at the streets in the news today and you see the college campus is aflame with hatred and anger and all of that stuff. And this is a great tool to be able to offer someone as a gift to read and get some insights as to how to bring about another approach to their current situation. And so I suggest that you guys step out and begin to purchase Doc's book and hand them out to all those kids out there that are searching and in pain and want to become this revolutionary optimist, if you will, and give them some insight from one who has been in the dance and has learned a few things. So I know, Doc, you have to run, but I want to thank you so much for coming to Threads of Enlightenment. I want to one day drag you back so we can get some more, because I know you have a wealth of information that is residing within that being of you. And so we would love to have you come back one day, but I want to thank you so much for coming and visiting us here at Threads of Enlightenment.
Thank you so much. Great to have you. Happy to come back. Just reach out to
Thanks.
me. Yeah.
Excellent.
Thanks for tuning in to Threads of Enlightenment with Ken Primus. Hopefully you're now feeling more empowered to overcome the challenges in your life, whatever they may be. Share that inspiration with others by telling them about this podcast, rating it, and of course, remember to subscribe so you don't miss a single episode. For more connection, you can find us on Facebook and Instagram by searching for Threads of Enlightenment. Until next time, stay enlightened.